All right. Hello, everyone. Dr. Labinton here. I help people live long and well because I believe the quality of life is just as important as the quantity of life. I'm super excited, as I always say, to be here again today having discussions on how to improve quality and quantity of life. If you're watching live, hashtag live. If you're watching replay, hashtag replay. If you know someone who should have who should be watching this video where we're talking about female incontinence and tips to staying dry and confident, please invite them, send this video to them for them to watch live. You can tag them, you could do the things, okay? Now, that being said, I am honored and delighted to have my guest today. She is Dr. Nabila Noor. Did I say that right? How'd I
Yes,
do?
you did. Perfect.
All right, awesome, awesome. She is a board certified and fellowship trained urogynecologist and reconstructive pelvic surgeon. And she's known to help women with different pelvic floor disorders, including, urinary incontinence, which we're talking about today. She's a big deal. She went to Duke University School of Medicine. She finished her residency of. You actually did OB-GYN and then you're, oh wow, okay, you've
I
been in school
did.
for a while,
Yeah.
doc. I
Yeah.
appreciate I appreciate you. So thank you for coming and spending your time with us this evening.
Thank you so much for having me. I am so excited to be a part of this and looking forward to our conversation.
All right, awesome, awesome. Now, my first question to you is this, Doc. Why? I know I introduced you. If you don't mind reintroducing yourself, who you are, what you do, and why you do what you do.
Yeah, absolutely. So, as you said, Dr. Levinton, I'm Dr. Nabila Noor. I'm a board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. Now, what that means is that I take care of women who's suffering from pelvic floor disorders. Now, pelvic floor disorders can be a whole gamut of conditions. It includes things like urinary leakage, bowel leakage, pelvic organ prolapse, also trauma from childbirth, so any kind of injuries that women may have related to their childbirth, as well as some non-surgical things like recurrent urinary tract infections, overactive bladder, pelvic pain, bladder pain. So there's a whole gamut of things that I treat. Now, traditionally, the thought was that most of these conditions are really affecting older women. But one of
Mhm.
the things that I love talking about and really feel passionate about telling people is that it can happen to women even as young as in their 20s and 30s. And I see that commonly, right? Women just had their first baby and now they're leaking urine. It's never normal to leak urine or leak stool. And one of the things that I feel very passionate about is educating women about their body, about their pelvic floor, what's normal, what's not normal. And no matter what they're suffering with, I think there's never a right or a wrong time to go see a specialist, talk to them about what's happening, and know what your options are so that you can make the most informed decision about your healthcare.
All right. I liked how you mentioned that this is not it's almost like sometimes this is an acceptable norm. Like, oh, you had a baby, this is a price to pay. You have a baby, so
Yes.
it's fair that you have all these things happening to you. So I like that we're having conversations where we could talk about things that are options for patients who struggle with these conditions.
Yeah.
Now that being said, my first question to you is that, like, for someone who's watching, okay, pelvic floor disorders, what does that mean?
Yeah.
What would you say to that?
No, that's a great question. And I think before I even talk about what pelvic floor disorder means, let's talk about what the pelvic floor is, right? So a
Yeah,
lot of
that's
people don't even know what a pelvic floor is.
good.
So the pelvic floor is essentially a combination of muscles and connective tissue that essentially forms the base of our torso, right? It's helping support our pelvic organs, which includes the uterus, the bladder, the rectum. So when we talk about pelvic floor dysfunction, essentially what that means is that that pelvic floor and the organs it's supporting is not working the right way. So, you can have symptoms affecting the bladder or the urinary system. So patients can have things like urinary leakage, urinary urgency, frequency, not being able to make it to the bathroom. Or you can have bowel issues where women are unable to control their stool or have difficulty even starting or initiating a bowel movement. Or people can have things like, what I see very commonly, pelvic organ prolapse, where because of trauma to those pelvic floor support structures, the pelvic organs are essentially trying to herniate through the vaginal canal. And what patients feel is that there's a ball hanging in between their legs, right? So none of this is normal. But to your point earlier, it's amazing how often we condition ourselves to thinking that, oh, I just had a baby, it's a little bit of leakage, that's fine. And past down 20 more years, they're going through menopause and people are telling them, well, you're going through menopause, you're going through a lot of changes, it's normal. And so by the time patients come to see me, they've been suffering with this for 20, 30 years, which they really didn't have to, because we have such amazing treatment options that we can offer them.
Thank you for saying that. And you alluded to something, my next question here, where we talk about typical symptoms. Because someone may be like, well, because if it's normal to you or something that has been happening for years, you're like, yeah, I just thought that was just part of being a woman who's had a kid.
Yeah.
But what are typical symptoms that may indicate a pelvic floor disorder?
Yeah. So let's start it from the very beginning, right? A lot of the times women, especially young women, notice it for the first time, probably when they're pregnant or right after childbirth, right? Maybe third trimester, they're starting to see that they're having a little bit of leakage of urine here and there, and they had maybe a long labor and had a vaginal delivery. And even after 6 weeks, they're still having leakage of urine, or they're not feeling that it feels the same down there, right? Now, our body goes through a lot of change when we have a baby, and rightfully so. But after 6 weeks, if you're continuing to have symptoms, whether it be of urinary symptoms where you're having difficulty controlling urine, or you're having to go to the bathroom every few hours, or you're just feeling that anatomically everything feels very lax or does not feel the same, my recommendation is always to go see a physician, see a specialist, get an exam done, get an evaluation done. If everything is fine and there's nothing to do intervention-wise, I, as a specialist, will be the first person to tell you, like, hey, your symptoms are not that bad. Let's kind of, focus on more behavioral things. Let's focus on more conservative options and what you can do to prevent it from getting worse. What I don't want, your audience and also patients to take away is that, I'm just going to live with it and just kind of manage it and never seek to see a specialist, because that's really one of my pet peeves. Is I see or hear this all the time. Like, I think one of the most common mistakes my patients make is thinking that their symptoms are not bad enough where they need to go see a specialist, and that's just not true.
Is there a benefit to going sooner aside from getting your symptoms resolved, or do you find that sometimes people come when it's almost too late? Would you say that when it comes
Yeah. No, I think it's always beneficial to come early, right? Because then we can focus on prevention and prevent it from getting worse. I think by the time I wouldn't say that, it's like too late to come, because we have amazing treatment options. But say, like, if you're a young woman or even women in their 40s and 50s who's just starting to see that something is not right, whether it be with urination or any of the other organs that we talked about, you go talk to a specialist. Like, when patients come to see me, I start with a history to get a sense of what it is that they're bothered by. We do a full evaluation. We do a pelvic exam, which is more detailed than, say, your general GYN exam, because we do a lot of measurements. We do a lot of details, anatomical evaluation. And then we can have a discussion based on what are your expectations that you're hoping to gain, and also what would be my recommendations. And one of the things that I always tell my patients is, in urogynecology, everything is quality of life. There's no right answer. There's no wrong answer. What we do and how aggressively we treat each patient is very individualized based on their kind of, understanding and their expectations. And it varies so much from patient to patient.
Okay. Thank you. Now I have someone who's watching who's like, well, this is not the kind of conversation I like to bring up with my doctor. Like, yeah, I'm leaking, or there's something going down there, or going on down there. One of the things I have found, I tend to ask the question, especially during a gyne visit, like, okay, what's going on down here? Any issues, any leaking, any issues during sex? And then things like, well, what are you avoiding to do because of these symptoms? Yes. Now, for someone who's watching, who's not very open to having these discussions, or maybe they don't see a doctor who tends to ask those kind of probing questions. Yeah. Any tips on how to break that ice?
Yeah, no, that's a great question. I think, the the first thing that I would recommend is just start realizing what you are feeling, right? I think the first thing that patients have to realize is what's normal and what's not normal, right? I don't think leaking urine at any point of your life is ever considered normal. Now, yes, age is a risk factor. So you'll hear women say that, oh, you're getting older. It's a part of aging. Yes, it is, but that doesn't mean that you have to suffer from it. So I think the first thing that I would try or hope patients take from this is that understanding that leaking urine, leaking stool, or if it feels like there's a ball hanging out from the vagina, or you're having a lot of infections that's just not getting treated, know that that's not normal. And even if your primary care doctor or your OBGYN don't bring it up, you may kind of, approach them, be like, I'm kind of suffering with these things. I would really appreciate if you could give me a referral to see a specialist. And I'll tell you, and I'm sure you'll agree, Dr. Alabintan, that as the primary care doctor, you'd be more than happy to refer your patient to somebody who can help them, right? Because then you're helping them improve their overall quality of life. So I have never had any primary care doctors not be willing to refer their patients. A lot of the times, as you probably know, it's probably because there's so many other things that you're discussing. And, maybe this is not something that patients think is their priority. But and a lot of the times they may just not know that these are even treatable options. And I think that's why we're doing this, is to educate women, educate patients that these are very treatable options. And there's lots of amazing treatment options for these.
Awesome. Awesome. So you heard the doctor, their options. You got to ask for what you need. All right.
Yes, absolutely.
I've had people say they don't go to the gym anymore because any kind of jumping will make them pee or leak.
Oh my goodness. Yes. I've had patients, like young women who cannot take their kids to the park because they're worried that if they jump on the trampoline park or they're running around with their kids, that they're going to have wet underwear. I have had older women miss their grandchildren's graduation or avoid going to public places with their friends because they don't know where the bathroom is going to be and they're worried about having an accident. Patients are suffering. They're depressed. They cannot communicate with their family why they don't want to go outside on a long road trip, because no matter how supportive your families are, it's not something, it can be a very isolating disease for most women who suffer from these. And not to mention that how it can affect their body image, how they perceive themselves. And, when we talk about intimacy, whether it be with their partner or in general, there's a lot of psychosocial impact that this can have. And it's not uncommon that I see many of my patients who've been suffering with this from over a long period of time be clinically depressed. And they may not even know that they're clinically depressed, but they definitely fulfill all the criteria based on symptoms.
All right. So I'm glad that we're having this conversation. There are options. You got to ask for what you need. And an improved quality of life is possible. So you can do the things that are important to you now or for you. Now, I have people who are wondering, well, doesn't it always need surgery? Don't I always have to do I don't want any surgery there. I've heard horror stories or something happened to somebody. But are there options outside of surgery? Of course, this is a broad question, but to the best of your ability, doc.
Yeah, no, I'm so glad you asked that, because you're right. Because when people see my title or they hear their primary care referring them to a surgeon, the automatic perception is, but I don't want surgery. I don't want to go to the surgeon, right? So and that's a fair point, right? Because my name suggests that I'm a surgeon. But the good news is there are amazing non-surgical treatment options as well as surgical treatment options. And I think that's one of the reasons what attracted me to this field is that as a surgeon, I love doing surgery, but I also have a lot of non-surgical treatment options that I can offer my patients. So it really gives me an opportunity to talk to my patients and, like I said before, cater the treatment based on their needs. And, like I said, it's all quality of life. I may have a patient who may say that, okay, I'm leaking a drop of urine in my underwear. That's unacceptable. So let's talk about the most definitive form of treatment for you. And then there are other patients who are like, you know what, Dr. Noor, I just wanted to come by and make sure it's nothing crazy. It's not cancer. I'm not dying. I know it's not perfect, but I'm okay. If I have to wear an underwear or like a little panty liner here and there, I'm okay. But I really don't want any intervention. And that's absolutely okay. But my job is to make sure that I offer you all the options so you can make the most informed decision and come up with something together that works for you.
That works for you. I like that. Now, I'm big on lifestyle. Are there
Yes.
lifestyle changes that women can do to help prevent or even manage pelvic floor disorders, Doc?
Yeah, no, absolutely. So let's talk about some of the risk factors, and I think that will just help talk about
That
kind
works.
of connect to what we can do to avoid it, right? So there are definitely some risk factors to pelvic floor disorders. Risk factors such as age, menopause, obesity is a big one, chronic constipation, chronic cough, pretty much anything that puts a lot of pressure on your pelvic floor on a constant basis can affect your pelvic floor functioning, as well as things like smoking, because it can affect the tissue quality. Of course, genetics you can't really do much about, but if you look at some of these risk factors, a lot of them are very modifiable, right? So, my patients with chronic constipation, I talk a lot about managing that constipation so they're not straining all the time, whether it be to have a bowel movement or even for some people to urinate. So, we talk about doing a lot of fiber supplements to make sure they're regular. And if they've tried some of the conservative measures and still not having any improvement, seeing a GI person so they can help come up with a regimen. Obesity, I mean, we know improving obesity can help with different aspects of your healthcare, but definitely the pelvic floor. And there's some amazing studies that shows even if you can reduce as low as 8% of your current body weight with just
Hmm.
behavioral changes and just normal exercises, that can significantly improve your urinary leakage symptoms. Things like smoking, right? Again, if you're somebody whose tissue quality is really affected, cutting down on smoking and preferably stopping it can definitely help. My patients who have chronic cough, managing their cough can be beneficial as well. So all these are modifiable risk factors. So if there's nothing that you want to do, addressing these risk factors can significantly help improve your symptoms.
Awesome, awesome. So now that we talked about the risk factors, what are lifestyle changes? Now you already addressed them. The coffee got to, address constipation. You want to minimize. Are
Yes.
there any other lifestyle changes that you think could help?
Yeah, so there's something called overactive bladder, which a lot of my patients suffer from. So these are my patients who feel like they're going to the bathroom all the time, like a lot of urinary urgency, frequency, not being able to make it to the bathroom. So when we talk about lifestyle changes for them, dietary changes, right? There are things that we know are common bladder irritants. So caffeine being a big one, soda, alcohol. You can't give up your coffee. Trust me,
Or
I am just as
coffee?
guilty. But if you're somebody who is suffering, maybe kind of cutting down a little bit can help modify some of those symptoms. Something we talk about like bladder retraining. So, if there are patients who are feeling that, they're going to the bathroom so much, we talk about don't always just give in to that urge. See if you can work on strengthening your pelvic floor muscles. Something we recommend is Kegel exercises, where you're kind of strengthening your pelvic floor muscles so you can control that urge a little bit better. So those can be helpful as well. Simple things like going on walks, right? Again, if you don't have to go crazy on trying to have like a fitness regime or trying to go to a gym on a daily basis, but even just moving, basic things can really help with some of the things we talked about.
All right. Now I have a question. I had someone ask me this, like, well, Kegel exercise, isn't that just like holding your urine? But you say we shouldn't hold our urine. Like,
Yeah. Yeah, no, that's a common misconception. So let's talk about Kegel because I think it is something that I recommend all my patients, even if patients who are just starting to see some symptoms, because it can really help prevent making these symptoms worse. So I always recommend my patients think of Kegel as a three-part process. You contract, you hold, and then you relax, and all three is very important. What I mean is like when you're contracting your pelvic floor muscles, you're holding it for a few seconds and then you're relaxing. Because if you're not doing the three in order, it can actually have negative effects. And I'll tell you why. Because a lot of the times, when we think about Kegel, we just think about contracting. But remember, a muscle has to relax. The pelvic floor muscles are just like any other muscles in the body, except that we can't see it. So it's a little bit difficult to know if we're working it the right way. But when you're just tightening those pelvic floor muscles and not relaxing it adequately, what happens is over time, those muscles can just get contracted and become really painful. And then patients can end up with the opposite problem, where now they're just basically having pelvic pain or pain with intercourse, something that we call myofascial tenderness. And that's a whole other issue and a whole other topic. But to your point, Kegels is not just holding it, but it's basically you're trying to train your muscles to strengthen them. So you contract, hold it, and then you relax. And I usually tell patients to do it in 15 sets, at least do 2 or 3 sets. So if in the morning you're doing 15 sets, you contract, you hold it for a second, and then you relax. The next 15, contract, hold it for 5 seconds, and then relax. And then the next 15, contract, hold it for 10 seconds, and then relax. So over time, you're building it up. Because, just like any other exercise, the money is in the repetition and doing it right. And I think that's where a lot of patients, fault, because they're not doing it the right way or not doing it enough.
Okay. Okay. And thank you for the explanation as far as seconds, because that's very, very helpful. So with holding the urine, that's not what, because you're not relaxing. Because you're
Correct.
holding the urine
Exactly.
the whole
Now,
time.
exactly. Now, when you're doing, it's the feeling of like you're holding your urine, but when you have to go, I don't want you to be holding it. I want you to empty your bladder, because that's another thing. Because, we oftentimes, when I see patients for the first time, a lot of what we discuss is what's normal voiding habits, right? So for us as females, because our urethra, which is basically the pipe through which urine comes out, is so short, it's only about 4 centimeters. All we have to do is just relax your pelvic floor muscles, and then, the urine just comes out by itself. Unlike men, because they have a long urethra, they actually have to generate force. So I don't want my patients to be trying to push that urine away. I want them to just take a deep breath, relax their pelvic floor muscles, and let the bladder do what it's supposed to do, which is basically contract and let the urine out. And a lot of the times, we see a lot of patients what we call dysfunctional voiding, where over many, many years, they have trained themselves to hold. I mean, you and I know, like, we're just as guilty, especially when we're training, right? We never went to the bathroom, and our bladder is not made to hold urine for 10, 12 hours. We should be emptying our bladder every 3 to 4 hours and not using a lot of force to get the urine out, because then you're using your abdominal muscles and not letting the bladder do the contraction. And so it's a lot of nuanced thinking, and, a lot of the preventative things, the lifestyle changes that we talk about is, again, simple things like, what is normal voiding? What should I be doing when I go to the bathroom? I mean, it sounds silly, but there's a lot that's happening anatomically, physiologically, and you can't go against that and expect that, it's going to continue to work the right way.
Oh, awesome. Awesome. Thank you for these tips. There's a way to pee.
There is a way to pee.
There's a way to pee. We got to pee correctly so we don't struggle with these issues. Okay, awesome. Now, for someone who's wondering, like, okay, I want to come see the doctor. I'm a little nervous because then, I'll probably have to expose my pelvic floor. Yeah. Any words of encouragement for that person who's watching, who says, I've made this has really affected the things I'm able to do, ways I'm able to interact, and I'm willing to take a chance, but I'm a little nervous. Any words of encouragement for these?
Absolutely. I think, the first visit with, any kind of specialist can be a little nerve-wracking because you don't know what to expect. So, the first time when I'm seeing a patient in my office, we just start with talking, just like we're talking today, right? We talk about what their symptoms are, what it is that they're, having problems with. We talk about their urinary symptoms, their bowel habits. We talk about any other changes they're worried about. We talk about their sexual health. And then, once I've gotten a full history, we go ahead and do an exam. And yes, a pelvic exam, nobody likes to get a pelvic exam, but I'm kind of talking my patients through the exam the whole time. And I tell them, look, at any point, if you get nervous or you're uncomfortable, please let me know and I'll stop, right? There's a lot we can even do, even with just getting a good history, like we talked about, like how much are they going? What is normal voiding? How much are they drinking? So even if I don't do a lot of exam, I can get a lot of information from just that conversation. And I think once patients feel that comfortable and they feel that, okay, this is somebody I can relate to, this is not a scary proposition or it's not a scary environment, they're a lot more comfortable to kind of let me do an exam. And it's just like anything else, right? It's like building a relationship, right? You should be able to trust me. And then similarly, I should be able to offer you what are some of the options. And together we come up with a plan that works for you.
All right. Thank you so much. This has been very helpful. We've learned options, things that are risk factors for pelvic disorders. We learned what a pelvic floor is. We learned how to pee and how to Kegel. So a lot of information here. But Doc, I have people who are wondering, who are like, you know what? I like this doctor. I want to follow her for content, learn other things that I can do to help improve my urogyne parts. Doc, where can people find you?
Yes, no. So I have a website. It's drnabilanoor.com. And I'm very active on social media for all the reasons we talked about, because I do feel very passionately about educating women. And it's hard, right? Because a lot of the things we talk about may be a little bit more nuanced. So, kind of, again, seeing the same face, talking about it, hopefully will encourage patients to be like, no, I can go see a specialist. So, yes, so I have a YouTube channel. It's Dr. Nabila Noor. I have an Instagram handle, Facebook, LinkedIn. Haven't quite ventured into TikTok yet, but that's my next venture. But like I said, I post daily contents and post weekly videos. A lot of the things that we talk about, there are lots of videos about it in more details. So by all means, reach out. You can also sign up for my newsletter. And if you ever want to contact me, all my information is on my website. And if you happen to be in the Lehigh Valley, Allentown area, please find us. We'll be happy to take care of you.
Awesome. Thank you so much, Doc, for coming and for the wealth of knowledge you shared with our viewers today. This was good. This is good.
Thank you. I had a wonderful time. I hope your audience finds this helpful, and we're happy to help whenever we can.
Thank you. Thank you. And for those of you who are watching, I have put her information at the bottom of the screen, the website, and she's made it very simple. You can find her Dr. Nabila Noor, YouTube, Instagram, Facebook, and LinkedIn. And so we have all that information at the bottom of the screen. But thank you all for joining me this evening. If you know someone who could use this video, please forward to them, share them. You could improve someone's quality of life just by hitting share. Okay. Thank you so much, Doc, for doing this. It's a wrap, 6:59 Central Time. Everyone have a good one. Thank you for watching. And as always, if you or anyone you know is looking for an awesome, a thorough, and compassionate family physician in the Mansfield, Texas area, I am she. Have a good one. Thank you so much, Doc. You rock.
Thank you so much for having me.